Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
We're diving into a fascinating area today, the connection between diabetes and hypothyroidism.
Oh, absolutely.
You've shared Dr. Bernstein's lecture, along with some really intriguing research from PubMed. Ready to unpack it all.
Yeah, let's dive in. This is one of those areas where, clinical observations and research, they often intersect in some really surprising ways.
So Dr. Bernstein, he really emphasizes that he sees hypothyroidism in almost all his new diabetic patients, which he claims is way more common than what standard diagnoses suggest.
Right.
And he's put a huge emphasis on looking at free T3 levels instead of just relying on the TSH test.
And that's a really crucial point, and you see this echoed in the research too, right?
Yeah.
He's essentially saying that free T3 gives you a much clearer picture of what's actually happening in the body.
It's like that analogy. Imagine trying to figure out how fast a car is going by only looking at how much gas the driver's giving it.
Exactly.
You're missing a huge part of the equation.
You're just looking at the gas pedal. Free T3 is like we're measuring the car's speed.
So it's not that TSH is useless.
Right.
It's just that it might not be telling the whole story.
Exactly. And several of the studies in this collection, they highlight that, especially when it comes to elderly diabetic patients. They point out that relying solely on TSH can lead to misdiagnoses because it doesn't always reflect how much active thyroid hormone is actually available.
And that's a problem because
it means people might be walking around with an underactive thyroid without even knowing it.
Right.
This is especially concerning for those with diabetes, as both conditions can influence each other in some really complex ways.
And this makes me think about Dr. Bernstein's approach to treatment, because he seems really passionate about personalized thyroid care, often using compounded, slow-release T3 medications for a more tailored approach.
Interesting.
He even has patients doing short-term memory tests to see how treatment is affecting them.
Wow.
It really highlights that he's not just looking at numbers on a chart. He's thinking about the whole person.
That focus on the individual experience is key. And it's interesting because the research does reflect a similar trend. While it delves into the mechanisms, like how different thyroid hormone types and dosages can affect blood sugar and metabolism, there's a growing understanding that one-size-fits-all doesn't work when it comes to hypothyroidism, especially for those managing diabetes alongside it.
So how does the research back up his observations about hyperthyroidism's impact on diabetes?
Okay.
Because he talks about patients experiencing muscle cramps, fatigue, even lymphedema, which, by the way, is basically swelling due to fluid buildup.
Right.
Dr. Bernstein seems to think these issues, which can be really severe in some cases, are often linked to undiagnosed or improperly treated hypothyroidism.
And there's definitely a connection there. Several of these studies we have here have looked into the relationship between hypothyroidism and a higher risk of diabetes-related complications. For instance, one study found that people with both type 1 diabetes and hypothyroidism were more likely to develop retinopathy, a condition that affects the eyes compared to those who only had diabetes.
So we're not just talking about feeling a bit tired, we're talking about potentially serious long-term damage.
Exactly. And that's why understanding this connection is so important, especially when you consider how common both conditions are.
So if we're thinking about treatment, Dr. Bernstein seems like a big proponent of this T3 therapy, often using those compounded slow-release formulations we talked about earlier. He seems really confident in its effectiveness, both for managing hypothyroid symptoms and improving overall diabetes control.
It's important to remember that his approach is based on his clinical experience, but it is interesting to see how it overlaps with some areas of research. A lot of studies are dedicated to unraveling the complexities of thyroid hormone replacement, especially using T3, whether by itself or with T4.
So it's like finding the right key for a very specific lock.
Yeah.
What works for one person might not work for another.
Exactly. And that's where research digs into the complexities of thyroid hormone metabolism and how it can differ from person to person.
Right.
Things like age, genetics, even other medications can affect how our bodies process these hormones, which further highlights the need for that personalized approach that Dr. Bernstein champions.
It's like adjusting the sails on a ship you constantly need to be aware of, even the slightest change in wind to stay on course.
That's a great analogy. And just like with sailing, those adjustments in treating hypothyroidism often involve more than just changing medication dosages.
You mean things like lifestyle changes, diet, stress management, exercise, all tailored to the individual.
Absolutely. It's about seeing the bigger picture and understanding that the body is this interconnected system addressing one aspect, like hypothyroidism, can create ripples in other areas, including diabetes management and overall well-being.
That actually reminds me, Dr. Bernstein also mentioned that people with diabetes often have other autoimmune conditions like psoriasis.
Mm, interesting.
And he seemed to suggest that there might be a connection there too. Have you seen anything about that in the research?
That's really interesting because there is a growing body of research suggesting that autoimmune diseases often occur together.
Okay.
In fact, one study found that individuals with type 1 diabetes were significantly more likely to have other autoimmune disorders, including hypothyroidism, celiac disease, and rheumatoid arthritis.
Wow, it's like a domino effect. Once one autoimmune condition develops, it increases the likelihood of others appearing. What could be causing this?
That's the million-dollar question, isn't it? While the exact mechanisms are still being studied, researchers believe that both genetics and environmental factors likely play a role.
It makes you wonder about the bigger picture, doesn't it? Like, if these conditions are often interconnected, are there potential common underlying factors or triggers that we need to be more aware of?
It's a question that's driving a lot of current research. Some studies are suggesting that chronic inflammation, imbalances in the gut microbiome, and even vitamin D deficiency might be involved in the development of autoimmune diseases, including both diabetes and hypothyroidism.
It seems like we're just scratching the surface when it comes to understanding these really complex relationships.
You're absolutely right. This deep dive has only highlighted just how much we're still learning about these conditions and how they interact with each other.
It's like opening one door only to discover a whole hallway of other doors waiting to be explored.
Precisely. And that's what makes it so exciting. As research continues, we're getting a deeper understanding of these intricate relationships, which will hopefully lead to more effective and personalized treatment strategies.
It sounds like we need to move away from a one-size-fits-all approach and towards a more individualized model of care, especially when dealing with complex conditions like diabetes and hypothyroidism.
Absolutely.
Yeah.
Recognizing the unique needs of each individual, considering their specific symptoms, genetics, and lifestyle factors, is essential for optimizing both diagnosis and treatment.
It's about empowering patients to be active participants in their health journey, working collaboratively with their healthcare providers to find the best path forward.
Exactly. And that includes advocating for more comprehensive testing, exploring alternative treatment options, and really paying attention to how they feel, not just what the lab numbers say.
So what does all of this mean for our listener?
It seems like Dr. Bernstein's clinical observations, while not always perfectly aligned with the current research, often highlight really important nuances about the diabetes-hypothyroidism connection.
Right.
Nuances that research is really only just starting to catch up on.
This raises such an important question. Could there be value in rethinking how we diagnose and manage hypothyroidism, especially for those also dealing with diabetes? It's definitely something to consider as you continue on your own health journey.
It feels like we're really starting to see how intertwined these conditions can be.
Mm.
But if we go back to what Dr. Bernstein was saying about personalized treatment, what are some of the specific things he recommends for managing hypothyroidism, in the context of diabetes?
Well, one thing he really stresses is regular monitoring of thyroid function in diabetic patients. He really emphasizes that treatment needs, they can change over time. And he advocates for going beyond just TSH levels for a more comprehensive assessment.
So not just relying on that single number, but looking at the whole picture.
Exactly. It's about recognizing those subtle shifts that can happen, especially when you're also managing diabetes, right?
Right.
And those adjustments, they might involve tweaking medication dosages, but also incorporating lifestyle changes like diet, stress management, even exercise routines, all tailored to the individual.
It's fascinating how he weaves those lifestyle factors into the equation.
It speaks to his holistic approach. He recognizes that the body isn't just this collection of isolated parts, right? What affects one system can ripple out and affect others.
And that seems to be a recurring theme in the research too, right? This idea that everything is interconnected.
Absolutely. We're seeing more and more research highlighting the importance of taking a broader perspective when treating chronic conditions. For example, some studies are exploring the role of chronic inflammation in both diabetes and hypothyroidism.
Is there anything in the research to support Dr. Bernstein's use of those compounded slow-release T3 medications?
While there aren't studies specifically looking at his exact formulations, there is a growing body of research investigating the use of T3 in treating hypothyroidism. Some studies suggest that using T3 alone, or in combination with T4, can lead to better outcomes for certain individuals, especially when dosages are carefully personalized.
That makes sense. Finding that sweet spot for each person.
Exactly. It's not a one-size-fits-all situation, and the research is really starting to delve into those nuances.
It's almost like we need a whole new model for understanding and treating these conditions.
It's an exciting time because we are seeing a shift towards more personalized medicine, where treatment plans are tailored to the individual's unique needs and circumstances.
This all feels incredibly important, especially for people who are like trying to navigate managing both diabetes and hypothyroidism.
Absolutely. Knowledge is power. And understanding these connections can empower individuals to advocate for themselves and work collaboratively with their healthcare providers.
Speaking of knowledge, Dr. Bernstein also talked about how hypothyroidism can affect energy levels and metabolism. Is there anything in the research to back that up?
Yes, actually, several studies have explored the link between hypothyroidism and metabolic function. They found that an underactive thyroid can slow down metabolism, which can lead to fatigue, weight gain, and difficulty losing weight.
So it's not just in people's heads. There's a real physiological basis for those energy slumps.
Exactly, and it highlights the importance of addressing even seemingly minor symptoms because they could be indicative of something more significant.
It makes you wonder how many people are just pushing through those symptoms, unaware that there might be an underlying condition that needs attention.
It's definitely a conversation worth having with your doctor, especially if you're experiencing persistent fatigue, weight changes, or any other symptoms that concern you.
It's all about connecting the dots and recognizing that our bodies are constantly sending us signals. It's up to us to pay attention and seek out the answers we need.
I couldn't agree more. It's about becoming an active participant in your own health journey.
So with all this talk about personalized treatment and individual needs, what are some of the key takeaways for our listeners? What can they do to advocate for themselves and potentially uncover a hidden hypothyroidism connection?
That's a great question, and it's one we'll explore in more depth as we continue this deep dive into the complex relationship between diabetes and hypothyroidism.
It really does feel like we've only just begun to scratch the surface of this whole complex relationship between diabetes and hypothyroidism.
It really is a deep dive.
What are some of the key takeaways our listeners should keep in mind, especially when it comes to advocating for their own health?
Yeah, you're right.
I think one of the biggest takeaways is just to be aware of the potential connection between these two conditions, right? Dr. Bernstein's clinical experience, coupled with what we're seeing in the research, suggests that hypothyroidism, it might be even more common in people with diabetes than previously thought.
And that it can have a much bigger impact on overall health and well-being than people realize.
Exactly.
So, if you're living with diabetes and you're experiencing symptoms like fatigue, weight changes, mood swings, even things that you might not automatically associate with hypothyroidism,
Right.
it's worth talking to your doctor about getting your thyroid levels checked.
And not just settling for a TSH test, right?
Right, exactly.
Dr. Bernstein's emphasis on free T3 levels seems really crucial here.
Absolutely. Advocating for more comprehensive testing is key. And then if you are diagnosed with hypothyroidism, being open to exploring different treatment options, whether it's medication, lifestyle changes, or a combination of both, is also really important, especially since, again, what works for one person might not work for another.
It all comes back to that idea of personalized care,
Yes.
recognizing that we're all unique and our bodies respond differently to treatment.
I couldn't agree more. And don't be afraid to ask questions, do your research, and be an active participant in your own healthcare journey. Knowledge really is power in these situations.
This has been an incredibly insightful deep dive.
It has been.
Thank you so much for breaking down this complex topic in such a clear and engaging way.
Oh, it's been my pleasure. This is an area I'm incredibly passionate about, and I hope this conversation empowers our listeners to take control of their health and advocate for their well-being.
Remember to like and subscribe, and thank you for listening.